All right, let's get into a really fascinating medical case. This is a story about how a totally routine procedure went off the rails and ended up revealing a hidden danger in a patient who, on the surface, seemed perfectly fine.
So this is really the heart of it all. What happens when you mix a standard, everyday surgery with a rare disease? It's a story about assumptions, about physiology, and, well, about how a person's unique biology can throw a massive curveball at what doctors think they know. So, to start, let's meet the person who's right at the center of this whole medical mystery. Our patient is a 27-year-old woman, and she used to be a classical ballet dancer. She's just coming in for a super common procedure, getting her wisdom teeth taken out. Now, the key detail here is that 4 years before this, she was diagnosed with a pretty rare condition called polymyositis. So what in the world is polymyositis? Well, think of it this way. It's an autoimmune disease where the body's own defense system gets confused and starts attacking its own muscle fibers. And as you can imagine, this causes inflammation and muscle weakness, which is a huge deal when you're talking about anesthesia.
And this quote from the actual case report really hits the nail on the head. Using muscle relaxants on these patients is, well, controversial. See, for someone with active polymyositis, the risks are pretty clear. But what about when the disease is controlled? That's a huge gray area, and that's exactly where our patient was.
And looking at her chart, everything seemed great. Her lab work was all normal, she wasn't dealing with any day-to-day muscle weakness, she was on a low dose of medication, and her polymyositis was considered totally stable. Controlled. No red flags, right?
Well, you can probably guess what's coming. During the procedure, this carefully controlled situation started to unravel, and it turned into a really tense medical puzzle.
Okay, so here's the play-by-play. At the very beginning, she gets a standard dose of a muscle relaxant called rocuronium. The surgery itself, super quick, only 85 minutes. But then, things start to get weird. 2 full hours after that first dose, the patient is still deeply paralyzed. It then takes another 12 minutes with a powerful reversal drug to finally get her to a point where she can wake up safely.
49%. Just let that number sink in for a minute. 2 hours after getting the drug, when she should have been almost totally recovered, her muscle function was less than halfway back. This was the first giant clue that something was seriously wrong.
Now, to really get what that 49% means, you have to understand how anesthesiologists measure this stuff. They use something called the train of 4, or TOF ratio. Just think of 100% as full strength. You absolutely have to be over 90% to breathe safely on your own. So at 49%, she was still profoundly paralyzed. And this just puts it all into perspective. In a healthy adult, you'd expect recovery from this drug in, say, 50 to 70 minutes. In her case, we're way past 120 minutes, and she wasn't even close. The drug's effect was lasting more than twice as long as it ever should have.
So at this point, the team brings out the big guns, the antidote. It's a drug called sugammadex. This stuff is literally designed to reverse rocuronium, and it's famous for being incredibly fast. Normally, we're talking about a 2-minute turnaround from deep paralysis to waking up.
But just look at this table from the report. That 2-minute fix, it turned into this slow, agonizing 12-minute climb. After 1 minute, she's only at 64%. 6 minutes go by, she's still only at 78%. Every single minute that ticked by was another minute of this unexpected paralysis, with the whole team just watching and waiting for that number to climb.
So, this leaves us with this huge 2-part mystery. First, why did the muscle relaxant last more than double the time it should have? And second, why did the so-called fast-acting antidote take 6 times longer than usual to actually work? To figure that out, we have to become medical detectives. We've got to look deeper, past that controlled label, and into the hidden damage that polymyositis had already caused.
So it turns out, even in that controlled state, the disease had left its mark. She had less muscle mass overall. But the really critical part was this. The tiny microscopic blood vessels inside the muscles, the capillaries, were damaged and blocked. This is called capillary obliteration. And what that really means is that blood flow into and out of her muscle tissue was just terrible.
So this bad blood flow set off a chain reaction. First, the muscle relaxant, rocuronium, slowly trickles into the muscle. Then it essentially gets stuck there because there's not enough blood flow to clear it away. That explains the super long paralysis. So then, when they inject the antidote, sugammadex, it's just kind of stuck waiting around in the bloodstream. It can only do its job as the rocuronium slowly leaks back out of the muscle. And that's why the reversal took forever.
This whole investigation brings us to the most important part of this entire story.
What did we actually learn from this incredibly surprising case?
And here it is, the conclusion right from the report itself. It says loud and clear that even with controlled polymyositis, patients can be extremely sensitive to these drugs. And the reason isn't the active disease, it's the permanent physical damage to the muscle's own plumbing system.
So when you boil it all down, this case teaches us some really vital lessons. Number one, controlled absolutely does not mean predictable. What's going on underneath, the hidden physiology, is way more important than what you see on the surface. And for anesthesiologists, it proves that you have to monitor patients constantly. It's non-negotiable. And finally, for patients like this, you can't just give drugs by the book. You have to carefully tailor every single dose.
And that just leaves us with this one last, pretty sobering question. This was just one patient with one rare disease. But it really makes you wonder, doesn't it? How many other controlled conditions out there are hiding similar physiological bombshells, just waiting for the right moment to show up?